Next three witnesses, which are the final witnesses for today, is Katerina Georgi for the CEO of the Foundation for Alcohol Research and Education, often read as FARE. Ms. Kate DaCosta, the New South Wales campaigner for the Alliance for Gambling Reform, and Mr. Benjamin Hamilton, the lived experience advocate for the Alliance for Gambling Reform. I could ask each of you to take either the oath or the affirmation and provide us with your full name and position. And then once we complete that, each of you to make a short opening statement. Katerina, we'll start with you.
Sure. So my name is Katerina Georgi and I'm the CEO of the Foundation for Alcohol Research and Education. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Thanks, Katerina. Kate?
Hello, I'm Kate DaCosta from the Alliance for Gambling Reform. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Thanks, Kate. Benjamin?
G'day, my name's Benjamin Hamilton. I'm a lived experience advocate for the Alliance for Gambling Reform. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Thanks very much. Katerina, did you want to start with a brief statement?
Yes, please. Now more than ever, we all want to be doing what we can to keep our families and communities healthy and safe. For many of us, the COVID-19 pandemic has created a lot of fear, uncertainty, financial strain and social isolation. All of these factors increase the risk of harm from alcohol products in our homes, including family violence, alcohol use disorder, poor mental health, anxiety and suicide. If we're not paying attention to these harms, then it is easy to miss them, but they are happening. And in fact, even before COVID-19 restrictions, the home is where most alcohol products are used, with alcohol companies selling about 80% of its products through bottle shops and online. In May, when Fair and Women's Safety New South Wales reached out to people working on the front line of family violence services, more than half of them said they'd noticed alcohol was involved in more family violence incidents than before the COVID-19 restrictions came into place. Data from the Australian Government's National Alcohol and Other Drug Hotline shows that calls have doubled in the months of March to April. And Hello Sunday Morning's Daybreak app has also experienced increased demand, with people using the app increasing by more than 50% in April and high rates continuing. The data from some of the biggest alcohol retailers tells a similar story. Woolworths controls about half of the alcohol takeaway market in Australia. In the most recent quarter of April to June, total alcohol sales increased almost one quarter from the year before. Woolworths has also seen an increase in online alcohol sales by close to 30%, while their rapid alcohol deliveries have increased by 161%. Given these changes in how alcohol retailers are pushing their products out into the community and into our homes, it's important that the standards that we set for how they operate keeps pace. Our community expects alcohol companies to operate responsibly, and that means ensuring alcohol is not sold to children or to people who are intoxicated, and that companies sell alcohol do all they can to minimise the harms from these products. Many of these community expectations are not being met by companies selling alcohol online and delivering it. Just prior to the pandemic, Fair's annual alcohol poll found that 15% of Australians had purchased alcohol online in the past 12 months, and almost 1 in 4 of these had alcohol delivered at least weekly. Of those who had alcohol delivered within 2 hours, 70% drank at risky levels, with 38% who drank 11 or more standard drinks. The Liquor Amendment Bill that is currently before the New South Wales Parliament provides an opportunity to close these loopholes. And this includes common sense measures like verifying age online when people are buying alcohol to ensure that it's not sold to children, making sure that companies are not selling alcohol to people who are intoxicated, ensuring that they have a certified responsible service of alcohol training, making sure that alcohol is not sold into the home very late at night, and introducing a 2-hour delay between when alcohol is purchased and delivered. These common sense measures will help to keep families and communities healthy and safe by reducing and preventing harm from alcohol now and into the future.
Thanks, Katerina. Kate and or Benjamin? You're still on mute. Yeah.
Sorry about that.
See
The
now.
mute button always disappears. I'll be making an opening statement on behalf of both myself and Ben. I'd like to thank the committee for the invitation. I'm Dr. Kate DaCosta, New South Wales campaigner for the Alliance for Gambling Reform. The Alliance is a registered public health charity and advocates nationally for systemic change that will reduce and prevent the harm from gambling. Ben Hamilton is here with me. Ben is a lived experience advocate, one of over 70 people now working with the Alliance, sharing their experiences of gambling harm, whether through their own or another's gambling. We believe the committee may be interested in this alternative evidence base. The Alliance contends that the flaws in the informed choice, responsible gambling, individual responsibility industry model in relation to gambling in New South Wales have been exposed by the pandemic, and a public health approach would have dealt with the issues which have arisen in a way that would not have exacerbated harms. We believe that there has been a wasted opportunity to use the reopening to create safer venues, emphasising live entertainment, to rebuild social connections and reduce reliance on gambling revenues. We wish to note specific issues related to the management of the close down and reopening and concessions the industry received, including approvals to expand gambling rooms before submissions on applications closed, deferral on fees based on applications from poker machine manufacturers, and no evidence of extra support during shutdown or at the restart for those most impacted by poker machine use, including venue staff. Given that Clubs New South Wales, rather than the Chief Health Officer or any government minister, made the announcement that poker machines would restart on June 1st, and they boasted that they had convinced the Chief Health Officer to lift the number of people that could attend at a venue, we hold concerns about the sources of information available to the Chief Health Officer in the lead up to poker machines restarting. In particular, we asked the Premier and Health Minister whether the Chief Health Officer considered factors which make gambling rooms high risk for transmission. These include the behaviours of those at poker machines, like uncontrollable compulsive touching of hard surfaces, sweating, crying and other outward signs of distress, using more than one machine at a time, and possessive attitudes to machines, aggressively not allowing others to touch machines, including staff attempting to clean. The risk factors of frequent gamblers, putting them at risk of severe complications if they contract COVID-19, are that they are more likely to be over 60, more likely to be overweight, and more likely to smoke. We received no reply. We still hold these concerns while the virus remains in the community. New South Wales, like every other state that has reopened, certainly snapped back in terms of gambling losses. In the first week, with around less than 60% of machines back on and fewer people out, losses were higher than in the same week in June 2019. In clubs, $8 million was lost every day in the first week and $4.6 million every day in hotels. This $12.6 million daily loss compares to $11.7 million in June 2019, with maximum machines and more patrons. We want to place on the public record also alternative evidence of gambling-related employment figure claims. South Australian research shows that $1 million invested in food and beverages creates 20 jobs, whereas $1 million lost through gambling creates only 3 jobs. The Productivity Commission was equivocal on gambling-related employment boosts, and recent Victorian research estimates the social cost of gambling in that state to be $7 billion a year. Thank you.
Thanks very much, Kate. I might hand over to my colleague, Ms. Kate Fairman, for the first question.
Thanks, Chair, and thank you all for appearing today and the work that you continue to do in the important work you do in the spaces that you work. I thought I'd just maybe ask Ben this question, actually. We had the AHA appear earlier today and I asked them about whether there was a separate COVID-19 plan for gaming rooms and whether people could only go into gaming rooms in pubs for a particular length of time. There doesn't appear to be that, so people can go in and play the poker machines for quite a lot of time. Did you just want to speak about your experience? I don't know what these rooms are like really. Your experience from, I'm assuming, was it your own experience or somebody in your family about poker machines? And well, firstly that, and we'll go from there.
Thanks, Kate. Yeah, so it was my own lived experience with gambling. I spent the better part of a decade suffering from a poker machine addiction. In 2018, I tried to suicide because of that addiction. Thankfully, I wasn't successful, and I'm still sitting here today. And since that day, I made a promise to myself and my loved ones that I would change my own behaviour, but also try and help people who suffer from the gambling addiction. I started my own social movement at the start of this year to help people, and we've now moved into advocacy, working very closely with the Alliance for Gambling Reform and other organisations. We've since started to take a really close look at the industry and how it conducts itself. As far as the gaming rooms are concerned, most people that gamble there that do struggle with a gambling addiction, they're there for huge periods of time, hours and hours. As far as the whole my own personal issues with the gaming rooms at the moment post-COVID is, I mean, I did a walkthrough through a big RSL the other weekend, and there was, to me, in my own personal opinion, there was clear breaches in regards to COVID and yeah, like, you know, multiple people touching the same machine, people jumping on machines without, you know, any cleaning or anything happening. It seems pretty washy, in my opinion, with how these venues are operating at the moment. I don't understand how some industries can be so, you know, stringently targeted with COVID health measures and you know, for a good reason. But you know, when it comes to the gambling industry, particularly poker machines, it doesn't seem to be. They're playing by a different set of rules.
Thank you. And then, sorry, Kate, were you about to? That was my feedback, I think.
Okay.
Sorry. Also, that's the kind of hygiene side of it, I suppose. Then there's also the financial hardship side of it. So we've got people suffering financially. You know, some people are able to kind of keep their heads afloat with JobKeeper, but at the same time, we have seen almost record, as Kate DaCosta said earlier, this June, the week after reopening, more people were playing the poker machines than the previous year. From your experience as well, Ben, what does that financial loss, like, what was that like for you? And I'm assuming they can be significant. You know, we hear stories of people losing just so much money and losing their houses ultimately.
Yeah, the financial implications are huge. I mean, it crippled me financially. It's coming up very closely to a year since I last gambled. I'm only just starting to recover now. It takes everything, and financial implications are just one thing. It takes so much more than that. And through doing my own work with my own movement, I speak to many people that are still gambling, and they're suffering. The machines are designed to condition and addict people. That's the truth of the poker machines, and they do that well, particularly when people are vulnerable. And most people, you know, post-COVID are very vulnerable at the moment. People have lost their jobs. There's a lot of stress at home. You don't know where money's coming. There's a lot of stuff up in the air at the moment with assistance and everything else. So people are vulnerable. People are going and gambling and yeah, it's a recipe for disaster in my opinion. I nearly lost everything to pokies, like I said. Not only just my money, but I nearly lost my life. And I still speak to a lot of people that are still struggling. I've spoken to thousands of people since I started my movement at the start of this year, and I work very closely with a lot of people at the moment that are acutely at risk of suicide because of the machines, and they see it as like an option out of the, you know, they've lost their job, they're stressed at home, they can't put food on the table. So they see that as an avenue of trying to pull themselves out of that hole, and it's just a disgrace in my opinion. It needs to change, and the industry needs to start playing by the rules that everybody else plays by.
I'll just throw probably what the AHA and other venue owners with poker machines would say at this point, and that is potentially that given the financial hits that they have taken during COVID, that the income from poker machines is an essential component, or the component that's keeping many of them afloat. And with this, I'll also throw to fair, because after that, because we're also hearing in a similar vein from music venues, for example, that now for them to stay afloat, or for theatres, there has to be a kind of sale of 2 drinks, like a minimum sale of 2 drinks. And it's almost like we've got pokies and alcohol sales, if you like, keeping various venues afloat. But I wanted to just get that sense, maybe Kate DaCosta, what do you say to, poker machines really being, they're there and they're keeping pubs afloat at this point?
Thanks, Kate. Look, it is, we concede, a wicked problem, but it's a wicked problem that has developed from decades of poor business plans in New South Wales. We have a perfect example to contrast New South Wales here, in that Western Australian pubs and clubs don't have poker machines. So they too are having to reopen after COVID close downs. I'm not sure the extent in Western Australia, but certainly in South Australia, where there are far fewer poker machines, again, there was a close down and then a reopening. Most of those venues are still reopening. I'm sure they're doing it tough, but they are managing to reopen without the subsidy of poker machine losses. It is particularly in New South Wales, where business models of venues have made poker machines currently intrinsic to survival, and that is unsustainable in our view. So, as I pointed out in the opening statement, the claims of employment that every job in hospitality is dependent on 92,882 poker machines coming back online as quickly as possible can be challenged. That if that money was not being lost in poker machines but being spent on live entertainment or more food and beverage sales, and I've heard to the discussions this morning from restaurants and cafes and the music and theatre industries. It's not easy, and it's not a simple solution as we come out of COVID. But that money creates jobs, creates more jobs being spent in those industries than going down the throat of a poker machine. Thank you.
Thank you. And could you just, for the committee again, what's the daily loss in New South Wales to poker machines? What was that figure, Kate?
So it's a bit hard to tell now because we're back 3 months after restart, and the data doesn't come out very regularly in New South Wales. But in the first week, the daily losses were $12.6 million. That's every day. And the normal losses in New South Wales in a normal year, every day, is $18.7 million. So I would put that that's not really the result of harmless flutters, and that it's not just people that we like to stereotype as people who have very low incomes and can't make good decisions. It's patronising, but it's also young football players on $100,000, $200,000 a year who are getting themselves into trouble through machines that are designed to make addicted when you're at your most vulnerable and least resilient.
Look, thanks for your evidence in this regard, and obviously there's deeply troubling impacts from the poker machines coming back online. But could I ask you to reflect upon those few short months that we had where the poker machines were all offline? What was the effect of actually taking poker machines out of the mix socially? Did you have any reports to that effect? Kate, Benjamin?
Unfortunately, there has been no, as far as we understand, no New South Wales research directly on this, but we understand that Deakin University undertook an online survey to test the experiences of people during COVID. Anecdotally, we have had a lot of reports that people felt safe. Many people said they felt safe for the first time in years because the temptation wasn't there. Whether they wanted to or not, they simply couldn't play poker machines. We had a woman contact us early in the process who said that for the first time she was able to buy Easter eggs for her kids because she had money at home. She hadn't been spending on poker machines. And the available evidence, thankfully, shows that our predictions of a big shift on to online gambling didn't happen, that online gamblers seem to have slightly increased their gambling, but there wasn't a big shift from people who were accustomed to using poker machines to online gambling. There was about a 10% increase in new accounts in the shutdown period, but it hasn't been that massive shift that we did fear. So for a lot of people, this was a respite, but in New South Wales, because the shutdown was so short, it's been too short for many people to reset their behaviour patterns.
Benjamin, did you have anything to add on that?
Yeah, I do, mate. As Kate said, and I said this, the first ever media engagement I did with the Alliance was ABC Radio, and I said on the radio, it's the first time in my entire adult life, I'm 30 this year, that I felt safe, and I cried because it's the truth. Admittedly, I was going pre-COVID, I was doing really well with my recovery from my gambling addiction, but it was like the first time in my adult life that I could take a breath because the temptation wasn't there. As I've said before, I speak to many, many people that still struggle with gambling, and that brief period where the machines were switched off, people just started living again. They had money to do things. They had money to take their kids places. They were able to pay their bills on time. They started getting, their self-esteem and their pride back because that wasn't there. Now, there is an argument to say that people will go online. My personal views on that, and I am an expert by experience, and I speak to many other experts by experience, it's not true. There's a whole suite of things that goes into a poker machine addiction, and to try and substitute that addiction with an online version of a poker machine, for most people that I've spoken to, including myself, it doesn't stack up to the real thing. It's very difficult to get. My understanding is it's illegal in this country with the online slots, etc. And it's very difficult to get your money, even if you do win online. These companies are set up out there. They say, "Oh, wait another 7 days, and we need this proof, or we need that." And before you know it, the money you've won's already there, punched back through their software. So, yes, there is arguments to say that people will just shift. The New South Wales Government had a perfect opportunity to really help people like myself when the machines were forced to be switched off, and they chose to. My understanding was that Clubs New South Wales, etc., really had an impact on public health policy, and they chose to turn the machines back on, which in my opinion is just insane. It was the first time where people could actually take a step back and realise what they're doing and how they're destroying their lives, and they just rushed the whole process to turn the machines back on, and most people just fell back into what they were doing before. You're 4 times more likely to suicide with a gambling addiction. Again, more needs to be done with this stuff, and I just hope that something really positive comes from this, and more people are speaking up about this, and I'm going to continue to speak up about this until something changes.
Thanks, Benjamin. I'm going to go to John Graham and then Natalie Ward.
I was keen to...
I'm not given only a minute at the end.
If you're lucky. John Graham.
I was keen to ask a question of Katarina and Fair. Fair's talked about the lack of alcohol sales data in New South Wales, unlike most other states. What I was interested in was what would you be able to tell us about alcohol sales in a state such as Victoria that you can't tell us about in New South Wales? What data is missing that the Parliament might like to have scrutiny over that simply isn't available because that isn't the case in New South Wales?
Yeah, thanks for that. So New South Wales and South Australia are the only two states that don't collect sales data. And what sales data allows us to do is to understand how much alcohol is being sold at a level that's a little more detailed, so that we can have at local government level, we can have a look at different regions, and then we can have a look at other data like ambulance data or hospital data or police data, and we can use all of those different data sets to get a good understanding of what's going on in the ground. And we don't have that capacity in New South Wales at the moment. So we're relying on more population-wide data, so surveys, and industries themselves have this data available to them, but we don't have it to inform policy making. And policy making can be more targeted if we do have that information available. So it's a big blind spot in our capacity to be able to keep people healthy and safe.
And you referred to the government's 24-hour economy bill. One of the good things about this bill was that it was put out first as a draft exposure bill and then is being reintroduced now as a final bill. That's quite unusual in the New South Wales Parliament. And I actually think it was one of the very good things that that process was being used. There's been debate, though, about whether some of the online sales measures in that bill have been weakened in the move from the draft to the final bill. Do you have a view on that now that the bill's been introduced?
Yeah, there's a huge loophole in our current liquor acts around online alcohol sales and delivery. And it's a huge area of growth. And, the data that I used on Woolworths was a good indication of that because they control so much of the market. And so things like checking for ID at the point of sale. So that would mean that when someone jumps online, their ID is checked and verified to make sure that they're 18. There are really simple plugins that can be applied to do that in the same way that a PayPal account's applied. And in the previous draft of the bill, there was a requirement to do that. And now that's been watered down and it's been pushed back to the regs. And the argument is that, we need to take more time on this, but we can do this. And it is something that makes a lot of sense because none of us want alcohol to be sold to children. So it's one of the areas where, there's been some watering down, and it's certainly a lot of public health, a lot of children's, a lot of community organisations are saying that this should be something that happens, and it happens in bricks and mortar establishments, so it should happen online.
Natalie.
Thank you, Chair. I just want to check whether you can hear me.
We can.
All right. Thank you. Thank you, all of you, for assisting the committee today and coming along. We're very appreciative of your input. My question is to Katerina. Thank you for your submissions, and we've met and discussed some of the concerns you have. The Honourable John Graham did cover some of the ground that I wanted to, and I just wanted to ask about the exposure bill and your comments on the bill, and particularly home delivery issues, if you could comment on those.
Yeah, absolutely. So the bill as it stands at the moment still includes a requirement to make sure that alcohol isn't being sold to people who are intoxicated through online delivery. So that's really great. But there has been a weakening of that age verification measure. It also still has quite weak provisions around responsible service of alcohol. So it allows the industry to create their own training or information around this rather than requiring them to do the accredited responsible service of alcohol training that all other alcohol producers, providers, people who sell alcohol have to do across New South Wales. The other thing about the bill is it allows for alcohol to be sold into the home really late at night. And so the time was up until midnight in the draft bill, and now that says between midnight and 5 a.m. there won't be sales. So that means between 5 a.m. and midnight, alcohol can be sold through online delivery. And that's a vast majority of the day. And that we know will create and contribute to greater levels of harm because we know more harm is more likely to happen later at night. And that includes increased risks of mental health concerns like suicide as well. And so we've been proposing a common sense measure of stopping that between 9 and midday, so 9 p.m. and midday. And that would mean that people can still order a bottle of wine with their dinner or can plan to have alcohol delivered, but it stops that super rapid delivery late at night. Rapid delivery is another huge thing. So we know that rapid delivery is associated with more risky alcohol use. And so rapid delivery is where you can phone a company like BWS or Dan Murphy's and have them deliver to your house within 30 minutes. We know that that type of delivery is associated with higher risk use. And so what we've proposed is a 2-hour delay between when the order is made, when the delivery comes to someone's house. And that means that it won't be used to top up and it won't be used to contribute to greater levels of intoxication and harm. And what we're talking about here is common sense measures to help keep families and kids safe. And to be completely honest, when I saw the sales increase by 86% in that first week of lockdown in March, these alcohol retail sales, I felt sick to my stomach thinking about how we were coming into an Easter weekend, and holidays are already really hard for people who have an uphill battle with alcohol, and just thinking about what families and people would be going through with that increase of alcohol. And so having these controls in place can make a real difference to reducing violence and harm.
Thank you. What would you say, just being devil's advocate here, what would you say about the inconsistency of that proposal? For example, at the moment, I think bottle shop hours are longer than what you've proposed, is the, kind of cutting it off from 9 p.m. till midday, but people could go to a bottle shop. Some might say that that's inconsistent. What would your response be to that?
So this direct pushing of alcohol into people's homes, and particularly that rapid use, we have information telling us the way that it's being used. And so with the information before us that says that 38% of people who are using that type of delivery are having 11 or more separate drinks, and with the information we have that says that later at the night it's higher risk, we know that that's happening with this type of alcohol sale into the home. And so with that information available, then we need to look at reducing harm. Look, when it comes to takeaway alcohol as well, those hours have been extended, and the extension of that hour does contribute, does contribute to increased harms, and we know that. And that was something that health groups and health professionals and groups like the College of Surgeons advocated quite strongly against. So we know there's harm associated with that as well. So why would we open or continue to open that up in the home when we know that that harm exists?
Could I just ask? Yep. Could I ask Katerina, if assuming that online alcohol sales won't disappear, if there are domestic violence orders or apprehended violence orders being made, would it make sense to have a kind of online register where an address could be added to that to also prohibit the alcohol sales to that address?
So, David, the thing to think about here is that online sales were increasing before COVID, and this has just meant that that increase has been exponential now. And so that increase in that market around online delivery was happening before then. What we've seen with alcohol sales is that they've stayed higher, and so what we're waiting to see now is as pubs and clubs and start to go back to normal, will people go back to drinking in that way and also keep this takeaway sales and these online sales higher as well? Because the sorts of habits that people are adopting now, that they're more likely to drink daily, they're more likely to drink earlier in the day, and those sorts of things are hard to shake once this is over. It's not something that people can just turn off. So in relation to people self-selecting to be out of these sorts of services or having it in place for particular people, what we're talking about here is prevention. And so we're not saying stopping anything. We're saying that if we put these sorts of common sense measures in, we can prevent some of these things from happening in the first place. And we can prevent it being used in a particular way where we're seeing it being used in a harmful way. And that's why things like, having those hours in place and having that 2-hour delay, it just means that, people are less likely to be using it when they're intoxicated, which means there's less likely to be harm in the first place. And we have information to tell us that this is something that could work to prevent that harm.
Any further questions? No?
Yeah, I just had,
John.
We
have time.
Okay. I just had one question on the gambling side of things. The research from Alpha Beta about the proportion of funds which had been gambled as people withdrew their superannuation was really quite astonishing. So it was really the second highest use of that. So money, people withdrawing from super, the second biggest category of things they put it into was gambling. I just wondered if you had any other information on top of that, what was quite a significant sample of data of 13,000 people.
Yes, I can take that. And I think immediately since the close down of poker machines, the Alpha Beta data showed a jump in online gambling expenditure. But we do have to remember, and that's alarming, and there's no doubt about it, that the expenditure on online gambling is still significantly less, order of magnitude less than the losses through poker machines. That doesn't mean we should not be concerned about online gambling. And the Alpha Beta data we discussed with their managing director. As you know, they have been working with Ilion, which is a credit card checker. So anyone who seeks credit has to provide evidence of their spending habits over the last 3 months. That's anonymised and sent to Alpha Beta to do these checks. And what we established from their categories was that also was capturing gambling on illegal online sites. This is more of a matter for the federal government than the state government about online gambling. And ACMA has been acting on this where they can to close down gambling sites, illegal gambling sites. So it would cover both registered bookmakers, sports and racing bookmakers, mostly registered in the Northern Territory. But the cowboys, who are offering the illegal casino sites and illegal slot machine sites, mostly to take all your money. It's almost impossible to get your money back out of those. It's hard enough to get your money back out of illegal bookmakers, but it's almost impossible with the illegal sites. And it is alarming that the superannuation drawdown went such a large proportion of that went into online gambling. But if we were to put the total losses of online gambling together against poker machine losses, they are dwarfed. It is the fastest growing category of gambling, but it is still, particularly in New South Wales, the losses are less. They're a poor proxy for harm, I admit, and it is also more, the regulation of that is more a matter for the federal government.
Thank you.
Look, I am sorry we've run out of time, but to each of you, Katerina, Benjamin and Kate, thank you very much for your evidence today. I know it's been of significant assistance to myself and I think for every member on the committee, and we appreciate the work that each of you do in the community.
Thank you.
Thank you.
Thank you. Thanks for the opportunity.
Thank you.
Thank you.